Welcome to Nursing Learners. Obstetrics and Gynecology. Question 90. 95% of fetal presentations are A. Breech, B. Shoulder, C. Cephalic, or D. Leg. Let's read the question again. 95% of fetal presentations are A. Breech, B. Shoulder, C. Cephalic, or D. Leg. The correct answer is C. Cephalic. Question 91. The most common presentation of the fetus during labor is A. Face, B. Shoulder, C. Breech, or D. Vertex. Let's read the question again. The most common presentation of the fetus during labor is A. Face, B. Shoulder, C. Breech, or D. Vertex. The correct answer is D. Vertex. We need to understand two important points before we go for a detailed explanation. These are presentation and presenting parts. The presentation is the part of the fetus that occupies the lower pole of the uterus or pelvic brim. The different fetal presentations during pregnancy are cephalic presentation, where the head occupies the lower pole of the uterus. In pedalic or breech presentation, the buttocks or foot. In shoulder presentation, the shoulder. And in compound presentation, more than one part of the fetus occupies the lower pole of the uterus. The second thing to understand here is the presenting part. The presenting part is the part of the presentation that lies over the internal os, which is felt by the examining finger through the cervical opening. In cephalic presentation, the presenting part may be the vertex, brow, or face. And in breech presentation, the presenting part may be the flexed leg and complete breech, the extended leg and frank breech, or a foot and footling breech. The pictures provided next may help you better understand the difference between the presentation and the presenting part. All the pictures on the screen here are of cephalic presentation. In the first two pictures, the presenting part is the vertex. In the third and fourth pictures, the presenting parts are the brow and the face, respectively. The next three pictures on the screen all show breech presentations. In the first picture, the presenting parts are extended legs known as a frank breech. In the second picture, the presenting parts are flexed legs known as complete breech. And in the third picture, the presenting part is a foot known as a footling breech. I believe now you can clearly distinguish between the presentation and the presenting part. The cephalic is the most common presentation, found in 96.5% of pregnancies. The pedalic or breech is found in 3%, the shoulder in 0.5% of pregnancies, and the compound is a rare presentation. In cephalic, the vertex is the most common presenting part, found in 96% of pregnancies. Please keep in mind that in common practice, the presenting part is also referred to as the presentation. As in question 91, both face and vertex are the presenting parts in cephalic presentation. But in the question, they are called a presentation. So, if the question asks about the most common presentation, the answer would be the cephalic. If it asks about the most common presenting part, the answer would be the vertex. But if is asks about the most common presentation, and cephalic is not given in the options, then choose the vertex as the answer. Question 92. The most favorable fetus presentation for normal vaginal delivery is A. Breech, B. Brow, C. Vertex, or D. Face. Let's read the question again. The most favorable fetus presentation for normal vaginal delivery is A. Breech, B. Brow, C. Vertex, or D. Face. The correct answer is C. Vertex. Cephalic is the most favorable fetal presentation for normal vaginal delivery. In cephalic presentations, the vertex is the most favorable fetal presentation for normal vaginal delivery. Question 93. When a cephalic presentation is complicated by the presence of a hand or a foot, it is called A. Vertex presentation, B. Face presentation, C. Compound presentation, or D. Brow presentation. Let's read the question again. When a cephalic presentation is complicated by the presence of a hand or a foot, it is called A. Vertex presentation, B. Face presentation, C. Compound presentation, or D. Brow presentation. The correct answer is C. Compound presentation. Presentation of more than one part of the fetus is called compound presentation. So, a cephalic presentation complicated by the presence of a hand or foot is called a compound presentation. The key points to remember here are: the most common presentation is cephalic. The most common presenting part is vertex. The most common presentation, but cephalic is not the option, is evertex. Most favorable presentation for normal vaginal delivery is cephalic. Most favorable presenting part for normal vaginal delivery is vertex. Most favorable presentation for normal vaginal delivery, but cephalic is not the option, is vertex. Thanks for watching the video. Please like, share, and subscribe Nursing Learners for more such videos.